Well, thank you. It's an honor to be here presenting on behalf of my co-authors, Dr. Knight, Dr. Hadlin, and Dr. Harris. Neither I nor my co-authors have any commercial relationships to disclose, and I'd like to acknowledge the funding support given by NIAAA and NIDA. So, understanding trajectories of teen substance use is critical for primary care physicians who are in the position to screen, briefly intervene, and then refer to treatment as is appropriate. And we know that escalation of use is influenced by parent, sibling, and peer use patterns, but most studies conducted to date have been based on school or community-based cohorts. And so trajectories of use among teens presenting in primary care, which is critical for primary care physicians to understand, have not yet well been characterized. The objectives of this study were twofold. One, to identify and classify major substance use trajectories of adolescent primary care patients during the 12 months following a routine clinic visit. And two, to identify the demographic and familial peer substance use associated with different trajectory groups. And hopefully this would help us identify risk or protective factors. The study analyzed data from a large quasi-experimental clinical trial, testing a computerized screening and brief intervention system for primary care. The study was conducted in 9 primary care urban, suburban, and rural practices in New England, with 12 to 18-year-olds presenting for routine primary care visits. The analysis sample for this study included adolescents in the treatment as usual arm, and they had to have both complete baseline and 12-month follow-up data. We assessed days of substance use in the past 90 days at both baseline and the 12-month follow-up using a modified timeline follow-back calendar-based interview. To create our trajectory groups, we first conducted a hierarchical cluster analysis to inform the generation of clinically meaningful trajectories, and then using cutoffs of 3 or more days of use to indicate past 90-day use, 3 or more days in the past 90 days to indicate at least monthly use, and 12 or more days in the past 90 days to indicate weekly use. We examined parent, sibling, and peer substance use exposure using subscales from the Personal Experience Inventory, which is a previously validated self-administered instrument on adolescent substance use and related risk factors. Each of these subscales has between 4 and 5 items, and if an adolescent answered agree or strongly agree to any of the items, we coded that as an affirmative response for our dichotomous variable. So for an example of parent use item on the subscale is, I have a parent whose use of alcohol or other drug worries me. An example of a sibling use question, I have a brother or a sister who gets drunk or high. And an example of the peer use scale would be, some kids I hang out with have trouble at school due to using alcohol or drugs. We then related parent, sibling, and peer substance use to trajectory group membership using logistic regression. So as for sample characteristics, among the 860 adolescents included in this sample, 61% were female, 66% were white non-Hispanic, with a mean age of the sample being 15.4 years and a standard deviation of 2 years. We found that past 90-day use of alcohol or other drugs to be 23% at baseline and 28% at the 12-month follow-up. And there were high rates of using both alcohol and drugs, so we examined overall substance use days rather than alcohol and drugs separately. So I'll be using the scatter plot to map the various trajectories that we identified. And first to orient you, the x-axis represents the number of days of use at baseline, so that could be anywhere from 0 to 90 days. And then along the y-axis, the number of days of use that that same adolescent reported at the 12-month follow-up. So every adolescent is a point on that scatter plot. And so the final trajectory groups consist of the following. First of all, there was a large portion, in fact the majority of the sample that had 0 days of use at baseline and 0 days of use at follow-up. And so these adolescents were assumed to have abstained from use. And what you're seeing in the box is the median days of use at baseline and then median days of use at follow-up, so 0 days to 0 days. The second trajectory that we identified was adolescents that had any level of substance use at baseline, but then went on to report 0 days of use at follow-up, suggesting that they ceased use. A small small portion of our sample, only 4% identified here in the left-hand corner, had 0 days of use at baseline and then escalated to milder use, so that would have been less than monthly use at the 12-month follow-up, and we categorized them as having initiated low levels of use. This next category had continued low-level use with some levels of use at baseline and some days of use at follow-up, but then throughout it stayed at less than monthly use. And this suggests that low levels of use is something that's relatively less frequent among the adolescents in this sample. This was a concerning category for us. 10% of adolescents rapidly escalated their use. Here the median number of days of use at baseline was 0, although it could have been 1 or 2 days in the last 90 days. And you can see that they escalated quite rapidly to monthly or more frequent use. And many of those dots that you see, like up towards the top, represent weekly use or more than weekly use. The next trajectory of adolescents were those with heavy use at baseline, and heavy use was being at least monthly use, and then they continued or may have even intensified that heavy use to the extent that they were using more than weekly at follow-up. And then the last group, consisting of 5% of the sample, was those adolescents that had relatively heavy use at baseline and then backed off to monthly use at the 12-month follow-up, and they were categorized as reduced heavy use. So having identified these trajectories, we then asked the question, if a clinician sees these teens in front of her, how is she going to predict the way that they're going to go when she sees them 12 months later? In this figure, looking at the entire sample of 860 youth, we broke down those that abstained and those that did not abstain by gender and age, and you'll see that there weren't any gender differences here, but there was a significant age difference in that the youth that abstained tended to be younger. It does raise the question of, are those just adolescents that haven't yet begun experimenting, and might they go on to do so? In the analysis, the odds ratio for remaining abstinent during the follow-up year, once adjusted for age and gender, we found that substance-using parents, siblings, and peers was associated with significantly reduced odds for remaining abstinent over the follow-up period as compared to those without such risk factors. And so this really highlighted to us the connection between parents, siblings, and peers' use with an adolescent's ability to abstain from alcohol and drugs. Our next analysis addressed the question of, how does the clinician predict which patients might have stopped substance use by the time she sees them after a year? Here we restricted the sample to the 198 who had any level of use at baseline. There were no gender or age differences, and what we found was that having peers who use substances significantly reduces the odds of adolescents ceasing alcohol or drug use at the 12-month follow-up. Here we did not see a significant effect of parents or siblings' use on the likelihood of a teen ceasing. And then finally, we wanted to know what factors for teens who at baseline may have been engaging in little or no levels of use, what factors might predict whether they go on to really escalate their use at the 12-month follow-up. Here there were no gender differences, but we did note that the older age was significantly associated with risk for being in this trajectory group. And you can see that from the age breakdown. And in this group, having siblings or peers that use significantly increased the risk for being in this concerning trajectory group after we adjusted for gender and age, as shown by the odds ratio being greater than 1. And in this group, we did not see a significant effect of parent use, although the trend was in the same direction. So the key findings for our study: reassuringly, a majority of teen primary care patients in this sample remained infrequent or non-users over the past year. Teens who abstained from use were less likely to report exposure to use by parents, siblings, and peers. Teens who ceased using were less likely to report exposure to use by peers, and the rapid escalators were more likely to be older youth who reported exposure to use by siblings and peers. And, our study had some strengths and limitations. First of all, a strength is that, to our knowledge, this is one of the first longitudinal studies conducted in primary care, making the findings particularly relevant for primary care clinicians. We also identified specific high-risk subgroups that might otherwise go undetected in primary care and some of the contributing risk potential limitations, the data collection relied on self-report. The sample was drawn from New England, and so how generalizable our sample is to other populations is unknown. And because the sample included only those completing the 12-month follow-up data, the high-risk patients may have been lost due to follow-up and might not be included in this analysis. Because we found that sibling, parent, and peer substance use are increasing the risk of teen substance use, this highlights the importance of pediatric providers to assess substance use by parents, siblings, and peers to understand the likely trajectories of adolescents' use that they might see in their primary care practice. Thank you.